Hello and welcome to PawTube, a Pause and Read initiative to drive awareness about pet health and wellness. Joining us on today's PawTube is Dr. Sara Capesciotti, physiotherapist at for small animals actually at Blue
Yes,
Oasis Veterinary Clinic in Dubai. And Sara has very kindly agreed to help us understand canine arthritis. A very warm welcome to PodTube, Sara. Thank you so
thank
much
you.
for joining me today.
Thank you so much. Thank you.
You
It's a
know,
pleasure for me as well.
likewise, likewise. Sara, even before getting into the course of treatment and so on and so forth, I would really like to, spend the next few minutes understanding what canine arthritis is and what would be the first signs of canine arthritis that pet parents should be aware of.
Okay, so I would like to start with what happens with daily with my clients. So, for example, sometimes clients come to Blue Oasis saying, my dog is very lethargic, is not as happy as before, and he doesn't want to go out for walks, so maybe he's sick. So they start thinking like maybe my dog needs blood tests because it is not feeling good, so maybe it might have some internal diseases or something similar. So that's very important to know that basically we have to have always like multimodal approach with arthritis, because it's the physiotherapist that has to collaborate with the senior doctor and nurses and everything. So just to understand what is the real problem, because like when a dog is lethargic or is in pain, a lot of things can be together. Like for example, sometimes they can have pancreatitis and arthritis, okay? But in this case, what happens is like that the dog, for example, goes for walks and he becomes very slow. Maybe before he was like running in front of you, always pulling with the leash, and then slowly starts walking behind you. And then, or maybe like he stays at home, he sleeps a lot, and when he's awake, he keeps licking, for example, his paws, which might indicate stress or might also indicate that might have inflammation of the wrist. Okay, arthritis can happen in different joints. It can happen like from toes of the front paws to the even spine, everywhere. So the most common arthritis that we treat, it's like elbows and hips and also spine. Okay, but it happens very often also to the wrist. So going back to what is arthritis, like what is scientific arthritis, basically we are speaking about an inflammation of the joints. Okay, it happens when the cartilage, that is a cushion that is between the end of the two bones that of the joint deteriorates. In this way, the joint starts frictioning. Okay, the bones start frictioning, and in this way, it creates inflammation. The problem of arthritis is that is a degenerative disease, which means that it progresses with the time. So it's very important to understand and to prevent it. Okay, so what you can do, arthritis can be prevented when, for example, when you have a puppy that is a giant breed or big breed, like the most common golden retriever, or like, I don't know, boxer, German shepherd, big breeds. Most of the time, they always have, they are very prone to develop arthritis. So the first thing we have to do, first of all, every time we adopt or choose a dog, we should know the description, the characteristics. So we already know that these dogs are prone to arthritis, so we can act immediately.
Sure.
Okay. So
I'll
yes,
interrupt you for a moment and ask you, you have already mentioned a few breeds, but do you think,
yeah.
and sizes as well. So, are large sized dogs, giant sized dogs, more susceptible to arthritis than
Yes,
perhaps smaller and
definitely.
medium sized?
Yes, definitely. But of course, you can see it only also in small dogs. Like I'm treating even Chihuahua for arthritis that are like 14 years old, and suddenly the owner said they don't want to jump anymore on the sofa, and they look weird. Like when they touch their back, they start crying. So all the breeds can be affected, but these ones for sure. That's why
And
for
is
large breeds, yes, yes, tell
Um,
me.
Sarah, when you speak about treating a Chihuahua,
Yeah.
is it more age related in that case?
Yes,
Such
yes. With
small
Chihuahua,
breeds?
yes, it depends, because sometimes like arthritis can be also related to small trauma. For example, you break your knee, and then there is a degeneration of the tissues that even if you have surgery, that causes arthritis. So in this case, like same, it's the degenerative process, even if it was caused by an injury. So the Chihuahua, even if it's a small breed, can develop arthritis. So, or even like with the age, like slowly the cartilage start deteriorating, because when we get old, all the mechanism and the metabolism gets lower,
Absolutely.
and this is what happens. Yes, exactly.
Okay.
Yeah,
Now, moving over to treatment, you've already used a very important terminology, multimodal. So,
yeah,
obviously, that means diet, that means pet proofing the home environment if necessary,
yeah,
supplement, as well as assisted physiotherapy. Could
yeah.
you please help us understand what is the most effective approach when it comes to canine arthritis?
So if I'm a pet owner and I know that my dog is big breed, the first thing I would do is prevention, which means that I will provide for my puppy like the good food. The food like is you have to know is my pet is big breed, so I have to give the puppy a giant breed food, which means that is already balanced. Okay, and when your pet is around like whatever pet that is more than 7 years old should start taking supplements, because when the cartilage is deteriorated, it means that even if you give supplements, that is nothing that you can do because cartilage is not there. So even if you give supplements, it's not worth it. You're basically wasting money. So when I speak about multimodal treatment, it means like if the pet comes in pain, what we do is and it's old. The first thing we have to do, we have to run a blood test, because the senior doctor for sure we ask to run blood tests, because of course like we cannot give painkillers or like strong medications if the pet is old and maybe has kidney issues or liver issues. So if the parameters are bad after blood test, the only treatment you have is physiotherapy and therapeutic laser and magnetic field. If the treatment, if the blood parameters are good, what you can do, you can start with anti-inflammatories with the association of physiotherapy and supplements, which is always the best approach to have the fastest results. But if your pet is very old and is in pain and cannot take any medication, you can have amazing results with the physiotherapy. I can give you an example of one of my clients that had a 12 years old golden retriever that he said, before he was, every time I arrived at home, he was greeting me, jumping around. And then like in the last 3-4 months, he's just there and he's not able to stand up, and he's really like, he would like to, but you can see that he's suffering. After 3 sessions of laser and some exercise that I provided them, he was able to do it again. So it's really effective. And most of the people think, oh, my dog started eating. Sometimes some vets like even suggest euthanasia because they say he's too
Mhm.
much in pain and cannot take painkillers because he's too old, has
Mhm.
kidney failure or whatever. So, which I don't agree with this, because we should always give a chance with physiotherapy because it really, really helps a lot.
I'm so
And
glad you said
yeah,
that, of so many important points there, from diet, supplements, and at what age. That is very important, to
yeah,
start at the
yeah,
right age to sort of preempt any degeneration in the
exactly,
first
exactly,
place. Sarah, would
exactly.
you also recommend daily exercises to sort of prevent
Yeah.
arthritis?
Yes. So basically, when you have an acute inflammation, which means that it's very, very painful for the dog, we should start first. If it allows you, if the blood test allows you, you start with painkillers, and then you start doing like passive exercise that are called even prom, which means that is you move all the joints of the body and to stimulate the synovial fluid, which is the lubricant that allows the joint to avoid frictioning. Okay, so more you move them. So that's why it's very important for a dog that arthritis that doesn't stop walking. What is always suggested that they go for short walks but often. Okay, so this is very important for them. And slowly, once the pet will feel better, in general, so what you do, you give painkillers, then you do these exercises, and then after you do 10 minutes ice pack. Okay, always, because it's like acute inflammation. After this, you can start slowly. You do like 3-4 treatment per week at home.
Okay.
Okay, that you have to do daily exercises. And then after this, you can introduce more exercise, and you can switch the cold pack to hot packs that help the muscles to for the flexibility and everything. So first of all, you have to control the pain that they have. Slowly, they will feel better. So you have to change the approach. But it works very well, and even during the first week, you can see very good results. And yes, this is what we do. Plus, of course, like we have an amazing machine here, for example, Blue Oasis, and it's called the ESA laser, that is called the cold laser, which means that doesn't work with the thermal effect, but only with the photobiomodulation. So it's only the light that goes in the joint and helps with the inflammation and to restore the flexibility of the muscles. We have different programs. And
Do you
basically,
also advise
yes.
hydrotherapy in such cases?
Okay, hydrotherapy is very good, especially like for dogs that are overweight. It's
Okay.
very important when that a dog with arthritis has to lose weight as soon as possible, especially when he's obese, because fatter he is, more pressure they put on the joint. So if you put this type of dog in the water, you allow him to lose weight
Mhm.
faster, and you also help him to put less pressure on the joints, which is very important. But it has to be done by a specialist. You cannot just put the dog in the water. Okay, for
Absolutely.
example, French bulldogs are not able to swim properly, so they need like special jacket or they can draw. So mm,
A
that's why
very
we have to
sort
be
of
very careful.
assisted
Yes.
and careful approach when it comes to hydrotherapy
Exactly.
with a
Hydrotherapy. Yes,
specialist.
it's not like you say, oh, my dog has arthritis, so sometimes like the vet say, okay, I need to go to the sea and swim with the dog. No, it's not like this, because it's very important the level of the water you use, like which joint you have to treat, and or maybe like you put the dog in the water when he has already a lot of inflammation without treating the inflammation first, and you make the thing worse. So it's not good to do this. It has to be like you have to have a plan of action. So in
Absolutely.
general, what I do, I start with if possible, with painkillers and laser therapy and passive exercise. And slowly, I switch to like exercises and then hydrotherapy. And then, of course, if you know what exercise you have to do and the hydrotherapist taught you how to do it, then you can go to the sea and try to swim with your dog. It really depends.
Okay,
Okay.
that's very nicely explained, step by step, and very nicely explained. Now, in cases, in severe cases, severely arthritic dogs or cats,
Yeah.
even, what
Yeah.
is the approach that you suggest?
When they are like very, I would say sick, and because they cannot move, it's very painful arthritis. When you are like in a severe, like late stage, it's very painful. So what I do, I always try to introduce like the lightest painkiller that is allowed, because of course most of the time the pet is very old when it happens, and like is a cycle of injections that you give first every week for 4 weeks,
Okay.
and then once per month, and this is associated with laser therapy at magnetic field, which means that the dog stays on the magnetic field that is similar to a carpet mat, stays there, and he relaxes. Okay, while I do laser therapy, so you can do these treatments all together. And then like first two treatments have to be done like in the first in 2 days in a row, and then you wait 3 days and you do another treatment. So if you follow strictly the protocol, it really works. And sometimes it depends, like if it's very severe arthritis and the dog is young, they might suggest you like surgery. but in its very, very bad cases, this is what we do. Sometimes it can really, it can still be treated conservatively. But another thing that we can do when arthritis is very severe, there are like special leg splints that are, or like braces, and that you can use on your dog. Basically, these splints like support the joint and improve the circulation, and like keeping stable the joint even when they jump or they run or like whatever they do. Sometimes they try it, okay, they feel better. This is another big problem that we have, that they say, okay, my dog wasn't moving, we started 1 week physiotherapy, my dog is running, jumping. This is not good, because it's like, it's normal that he feels better, but he can injure himself even more.
Again,
So we have to be very, very careful that once he feels better, we don't allow him to do whatever, even he's very happy and he seems young again. You cannot do this, because then it will get worse. So this kind of braces help them a lot. Another thing that you asked me before, but I didn't go ahead, is about the pet-proof environment. So the first thing I do during my first physiotherapy assessment is always like, I check the nails of the dogs or cats, and I also trim the fur that is under the paw pads, because it prevents the floor to be slippery. Okay, for them, because when they don't have good balance, they are very prone to like fall on the floor when it's slippery. So, and plus, if the nails are very long, imagine like if you have, for example, elbow dysplasia or like pain on the joints, what you do, you basically have a lot of pain there, and then you cannot even put enough weight on your paws because your nails are too long. So you start developing arthritis even on the toes, which is very bad and can create more pain. So the owners don't know. Sometimes they say, my pet, I don't trim the nails because he's too crazy. True. Sometimes, like with pugs, we need like 4 people to trim the nails because they go crazy. But still, if you go to your vet, I'm sure that they will help you to trim the nails. We are able to. We have a lot of methods, and we are able to trim the nails, and it's very important in this case. Plus, what you can do when they have arthritis, like in the corners, when the dog have to curve, basically you have to put mats, because it's the place where they are more prone like to fall, okay, when they curve. Plus, like if your pet wants to jump on the sofa and is used to stay with you watching the TV or like sleep with you, you have to provide like stairs or like ramp,
right.
small short stairs. You have to avoid completely the entrance to your stage. So you can use like baby gate, and you put it there, and that's it. So your pet is not allowed. If it's a small pet, then you can carry him upstairs. But it's very important that he doesn't go up and down, up and down. Very important. And then another thing is you have to raise raise up the food container that you have when you feed him. Like the container has to be on the height of the shoulders. So
Okay.
in this way, the pet doesn't have to put all the weight on the front legs, okay? And
Okay.
stress a lot the neck and the spine and everything. So you put it under here, and your pet will not stress his joints. Yeah.
Okay.
These are the most important. Plus, of course, a ramp to jump in the car would be very useful as well.
Or carry them up and down if they are
Exactly,
not too
exactly.
big, of course.
Exactly,
These are
because they are
such
used to do it, but you see that at some point they don't want to do it anymore, or they look there, they try, and then they can they can even break ligament or like break a bone because they try, but they are not able to.
absolutely. I mean, such valid points. So these are like these might seem like small, but such important points
Yeah,
that
you
you've
can really
just
make a
summarized
change.
here.
Yeah,
Yeah, yeah. And on that note, my last question to you, Sarah, you've shared a lot of wonderful suggestions, insights, and inputs. But my last question is going to be some really practical, everyday tips for pet parents to sort of
yeah.
avoid or even slow down the process of canine arthritis. What are some
Okay.
mindful steps that they should take?
Yeah. So the first thing I would do is diet. So starting from the young, like puppy, you do diet and you prevent the puppy to be obese in the future, which prevents arthritis a lot. So you have to provide always balanced food. So even if you want to give like homemade food, you have always to check with a nutritionist how to do it properly, because a lot of people, like clients, I heard that feed the dog only with rice or chicken. Okay, and this is not enough for the dog. So it has to be a balanced diet. You have to make sure that if your pet is very slow when he moves and is obese, you have to put him on diet immediately. If you don't know, because you say, you know, he's stealing like food from the cats, or he goes around, eats everything, then maybe you need a trainer that helps you with this, and you need like a vet that tells you like maybe you have to change for weight management food or like obesity food that helps you with this. With this part is like is written, like there are research that show that pet with arthritis can improve like more with the diet management than painkillers. So that's why it's very important that if that they are on diet when they are obese, especially when they have these problems. Plus, if you think that your dog is not as fast as before, first thing you have to do, you go to the vet and you explain all the symptoms, and then even if your doctor said, you know, like we can try with symptomatic treatment, always try to ask for x-rays, because x-rays always show very properly where is the problem, where is the if there is arthritis, and then you can start acting immediately. Don't wait too long, because you say, oh, maybe it's just tired. No, if it's like more than 6 years old, it can be already arthritis, and you have to start immediately. And then what else? Practical things. Yes, I would say all these home environment changes are very good. And always go for short walks and often when they have arthritis, because it helps them to have this lubricant in the joint, the synovial fluid. And when even they say, oh, the dog is tired, he doesn't want to walk. If he doesn't walk today, he will not walk tomorrow, and he will not walk anymore. So you have to force him to walk. Even few steps can make the change, because then they start losing muscles, and then it's like it's difficult to go back on track.
Absolutely.
Okay.
You know, if you allow me, I would like to add one more thing.
Sure.
The importance of actually budgeting for pet health requirements.
Yeah.
That's also very important because
Yeah.
uh, to do all of these things from diet to therapy to
Yeah.
supplements and everything else, it becomes a little expensive. So it's very
Yes.
important to sort of start budgeting early and keep aside a sum for their health and wellness needs, I think.
Yeah. Yes, of course, as we know, like Dubai is, but even like in Italy, like veterinary field is very expensive. But still, if you have a proper plan of action, you will not waste money. Okay, you have to
Exactly.
start immediately with everything. So if you will prevent arthritis starting from the food when the puppy is young, that means that in the future you will have less issues. So it's, before you get a dog, you should always understand what type of dog you are getting. If it's like big dog, small dog, what are the characteristics, if the dog should run when it's young or not. Like we have to be careful and read all the information. After this, like of course, if you we are back again at the multimodal approach. So if you go to your vet and your vet says your dog has arthritis, what we have to do, he will say, first we run blood tests, so we make sure that he doesn't have problems, and then we start painkillers and these things. Once the physiotherapy has started and shows the first results, then you don't need to come every time. So you will need to come like once per month and then once every 2 months. So maybe the first treatment you will do, like the first month, will be expensive, will be maybe more than around 1,000 dirhams, like yes, 1,000, 1,500, everything included with the consultation. But then after, like you will buy like another package of physio and only the supplements, and then you will have it like for several months, you know, like maybe for 5 months it will be enough. So that's why it's very important that your vet diagnose this problem immediately. So you have a plan
Absolutely.
of action, you don't waste your money, and you don't go around Dubai asking, or maybe my dog has like arthritis. You have to stick with one vet that knows and then you have to follow the instructions. Of course, if the pet feels better, if you stop doing the treatments, then it's done. I mean, you have to start everything from the scratch, because he will start developing the symptoms again, and then you have to pay again for painkillers, supplements, and physiotherapy from scratch. If you do the easy exercise that don't take more than 5-10 minutes per day, and you follow all the instructions we give you, then it means that you will not waste your money. So this is very important, but you have to trust, of course, your vet, and
Yes.
you have to be very strict with your dog, and plus very patient, because also dogs sometimes, like my clients, my patients, they come with me in the physiotherapy room, they are amazing, they do all the exercise, they go home, the client says, oh, my dog jumps everywhere when he's at home, he destroys everything, he doesn't want to do this exercise. With me, it's perfect. So sometimes I ask them to send videos, and I cannot see what I see in the videos because they
Yeah.
look really crazy. So we have to find some I don't know, we have to find a solution for this
Yeah,
as
and
well. Yeah,
practice everything mindfully, I guess. That's the key.
yeah,
Right from the
exactly,
beginning.
exactly. Yeah, exactly.
Thank you so much, Sarah, once
You're
again.
welcome.
Such a
You're welcome.
pleasure speaking with you. Thank you so much for joining us on PawTube.
You're welcome. Very happy to help you anytime you need.
Sure. Thank you so much and have a wonderful day ahead.
Thank you. Same to you.
Bye-bye.
Bye bye.
Bye.
Bye bye.